Let's talk about post-concussion syndrome. So you're looking at a cone beam CT scan. It is of a human, two humans. So we have an ideal human and then the post-concussive patient in question. So we're looking from the back to the front. Things should generally be 90-90. It's called orthogonal. So 90-90. And you can see on the red, that's the patient. They're all kind of tilted. So here's what happened. They were kicked in the back of the head. Yikes. Not by a soccer player, but they should probably be a soccer player. So anyways, patient has symptoms. Go figure. Dizziness, headache, neck pain, neurovisual issues. This is 2 years. They came to us 2 years after. They'd seen a whole slew of other providers, neurovisual providers, physical therapists, massage therapists, everything. But no one focused on the upper neck. Why was that a mistake? So here's what the research says. This is coming from a paper on post-traumatic craniocervical disorders, looking at folks who had post-concussion and whiplash disorders. What do you see the symptoms there? Let me move. Oh, you see dizziness, vertigo, headache, neck pain, visual complaints. And guess what? Gathered in the head and the neck structures, the ocular, sensory, motor, vestibular, cervical, proprioceptive systems, all involved in postural control, may be damaged by MTBI. Why did no one look at the neck? Let's look. Surprise, surprise, the issue is coming from the neck. What you're looking at here is a cervicocephalic kinesthetic sensibility test. Yikes. We call it the butterfly test. This is from our friends at NeckCare out in Iceland. Essentially, what we found is that the patient had trouble controlling their movement when they're following a dot. So the first thing, that's going to be ideal. So there's 3 tasks, easy, medium, and difficult. They're moving at different speeds, different directions, different times. Patient is the one in the middle, second down. That's the before, and you can see how things look off like a crayon, okay? So they're kind of doing this, almost parky. And then after our intervention, that's the after. Improvement. What was the intervention? Upper cervical chiropractic. I know, you're thinking those squigglies don't really matter, but our friends up here at the International Journal of Environmental Research and Public Health and their study, relationship between cervicocephalic kinesthetic sensibility measured during dynamic, unpredictable head movements and eye movement control or postural balance in neck pain patients, they're going to disagree with your skepticism. Interesting. Maybe the neck is going to create issues other than just the neck. Balance and eye movement issues? Let's find out. Look, more data. This is balance data from our friends at Balance Tracking Systems. This is an MCT-SIB, is clinically sensitive for balance disturbances, especially post-concussive. What you can see here with this patient is all of it is depressed. Proprioception, vision, and vestibular. So they had a balance issue pre-intervention. What about the eyes though? Yep, neurovisual issues, in particular with saccades. Saccades are quick movements back and forth, so think Serena Williams or Forrest Gump, take your pick. But essentially, this is a velocity evaluation, peak speed of the eye movement. We have an ideal way above, nice and fast. We have before, same patient, cattywampus. Before is pretty miserable. Try and get that bow and arrow, just kind of duds down like Robin Hood, the cartoon. And then you see the after, things look pretty strong. That's awesome. In particular, this patient felt great after the adjustment. Remember, upper cervical chiropractic, no twisty, popping, or cracking. And yeah, get your neck checked.